How does hygiene theory affect asthma in Latino communities? How does hygiene theory affect asthma in Latino communities? This is an important question, especially when considering chronic disease management. The hygiene theory, also known as the hygiene hypothesis, suggests that a lack of exposure to germs and infections during early childhood can impact the immune system's development. This limited exposure may increase the risk of allergic diseases, including asthma. In Latino communities, particularly those in urban or lower-income areas, the implications of this theory can be quite complex. Research shows that children in some poorer neighborhoods, even in places like Mexico, may have lower asthma rates despite being exposed to more environmental contaminants and infections. This paradox can be explained by the hygiene hypothesis, where early exposure to microbes might actually strengthen the immune system and reduce asthma risk. Asthma prevalence among Latino populations varies widely. Factors such as genetics, socioeconomic status, access to health care, and environmental exposures all play a role. For instance, studies reveal that Puerto Rican children have higher asthma rates than other Latino groups, and these differences cannot be solely attributed to socioeconomic factors. Immunological studies indicate that urban children in Latin America with higher exposure to infections often show immune profiles that are less associated with asthma. This supports the hygiene hypothesis. However, improved hygiene and reduced infections, which are often linked to better maternal education and living conditions, can lead to immune responses that increase allergic sensitization. This does not always mean an increase in asthma itself, but it can complicate the picture. When managing chronic diseases like asthma in Latino communities, understanding the hygiene hypothesis is essential. It highlights the need for a balanced approach. While it is important to reduce harmful infections and improve sanitation, overly sterile environments might inadvertently raise asthma risk. Practical steps include creating environments where children can safely encounter diverse microbes, promoting breastfeeding, and encouraging outdoor play. These activities may help develop healthier immune responses. Additionally, addressing barriers such as limited healthcare access, language differences, and economic challenges is vital for improving asthma control and outcomes in these communities. Education about asthma triggers, proper medication use, and environmental management tailored to community needs are key components of effective asthma management. The hygiene theory suggests that early microbial exposure can influence asthma development, but asthma risk is shaped by a mix of immune, environmental, social, and healthcare factors. Managing asthma in Latino communities requires integrating this understanding with culturally sensitive health education and improving access to care.